We're here in downtown Atlanta, Edgewood Avenue at Express Drugs. We're here with Kevin, the pharmacist, and we're going to talk a little bit about AIDS and the AIDS drugs. Okay. We got a new thing on the market. Or a new AIDS product on the market. We're still using the same. We're using the same product.
Actually, now we got now we're for compliance reasons we're using a triple.
Okay.
And it's basically it's one tablet with 3 types of antiretrovirals in it.
Okay.
Versus just getting 3 different types of tablets, because we find that when you give a patient 3 different types, that the compliance is decreased. But when you give them one tablet with 3 drugs in it, it increases compliance.
Okay. One of the things that they're talking about, especially on the news, they're talking about the increase in the AIDS problem. There's a great increase in the Afro-American community, the AIDS problem in America. Mm-hmm. And I mean, it's almost as bad as it is in Africa. So one of the reasons that we wanted to come down and talk to you about this, what do you see new things that are new drugs that are going to come on the market, new experimental drugs? Will we have any coming on the market, or we're just going to live with what we got and that being effective?
I mean, they're doing a lot of test trials and a lot of stuff that's still in the last stages before they be FDA approved. Mm-hmm. But not, to be honest, not really. I mean, the newest one is a 4 combination drug, but I'm not 100% sure of the name. You know,
the most important thing with the HIV is the non-compliance. They do not take their drug on time, and then there's a bunch of cocktails, and then there are 5-6 medicine. Now the new routine is that they incorporating all those pills to one pill.
That's good.
And then to make it, instead of taking it one every 12 hours, they make it one every 24 hours. Okay. So that it will increase the compliance. Okay. And the second thing is that it is increasing African American, because they don't look at it as they lay back because of the control on the HIV. Mm-hmm. They reduced the life expectancy. They increased it, and then they look at it that now the HIV is treatable, so it's not a big deal.
And it's going away.
Yeah, and then Magic Johnson had to do a lot with that. He's taking care of his treatment very well, and he looks very healthy. And then everybody's looking at saying that, there's a treatable disease, and then they lay down the condom and everything, and then this is what happens. Now you have the African American with 18, 17 years old with a full-blown HIV.
Well, now, question: the fact that Magic Johnson has a lot of money and can afford any kind of drugs that would be prescribed for him, are the people that you're talking about, the compliance, are they getting the same drugs?
They can get the same drug as long as if they have insurance, third-party Medicaid or Medicare. If they don't, this is you're talking about, like, there's a medication called Atripla. That's a 3 medication in one, and that's about almost $1,400 a month. So no people with the income of $30,000, $35,000 cannot afford to have a $14,000, $15,000 a month, $1,500 a month drug. That's about almost about $17,000, $18,000 a year.
Based upon your experience, how effective are they?
If the thing is that compliance. Mm-hmm. If these drugs, that includes antibiotic, has to be taken around the clock. If they say every 24 hours, you have to take it every 9 o'clock, or every 9 p.m., whatever, but it has to be around the clock, because these has the viruses and then the bacteria, they have a therapeutic window. If that medication, you don't take it around the clock, then what happens is that bug is going to become resistant, and that's why you have now HIV resistant, because of the non-compliance. All these people didn't take their medication correctly.
So what you would suggest then, in addition to once you have this disease, in addition to the medication, you also would advocate better education.
Better education. Education. Compliance.
Education, not just for the people who have it, that they got to take the medicine and it's got to be taken on time, but also
preventive.
Right.
Preventive education.
Yeah.
To people that how these things work. If you don't do protective sex, definitely it is there. You don't know who has it, who doesn't. You're gonna get it.
Yeah, that's true.
And once you get it, treatment is very difficult.
Now, once you got it, you got to take those medications for life.
Yes, indeed. So far, I see some of the patients we have that the doctors lay them out for a while.
Okay.
And then I'm sure at one time of their life they're going to come back to take it again because the immune system goes down and then this.
So in other words, so what happens when they're taking it? Some people, the immune system is strengthened, so the doctors can lay them off.
So what the HIV medication does, that what happens is that your CD4 level, that's the killer cells that fight with all this viruses, anything in the body, foreign.
Okay.
And then they increase that, and also the antibody loads that goes to, the less that becomes, the healthier you become on the HIV population.
Okay.
So those are the two therapeutic window they're looking at, to CD4 and then the antiviral load.
Okay. Well, we're here with Brother Joe and Joe the pharmacist, and Joe
Kevin.
and Kevin the pharmacist. Joe, give him your name. And
My name is Gulam Bakhtiari. I go by the Joe. People of my patient, they gave me that name, and then it stuck with me. And this is Kevin, Kevin Marshall. He's a pharmacist, and then he's helping me out a few days a week at the pharmacy.
praise God. Okay. All right. That's good. Listen, we want to thank you.
Thank you very much.
Thank you. And thank you,
Thank
Brother
you, Pastor
Kevin.
Carol.
Okay. All right, man. And that's valuable information there.
Yes, indeed. We will be glad to do it again.
No, that's valuable.
Yeah.
Okay.
All right, man.
Okay.